Hello everybody, I am here, Nathan Chan from Fertility, and I am with...
Hi, I'm Dr. Tamara Chan here from Full Potential Chiropractic.
Yeah, and it's an office in Southwest Calgary. So we're going to get right into it because I have a lot of questions about prenatal and pediatric chiropractic. So thank you for joining us. And just to make it clear, Dr. Chan is not biologically connected to me. You are my, sister from another sister. Okay, so just very briefly, in a couple seconds, what is chiropractic work?
So chiropractic, we look at the nervous system. So we've got a spine here. Everyone has one of these inside them. So looking at the spine, it houses your brain, your spinal cord, and all the nerves. So we directly work with the nervous system to make sure that your body is able to actually communicate, because you have your brain, and if you have kind of an analogy we like to use, like a kink in a hose, where you have these bones that come out of alignment. So like, if a water hose, you've got a kink in it. I mean, the water's still flowing, but it's less.
Okay.
Right? So if you basically have a misalignment, you stop that nerve from functioning, well, if this nerve goes to some of the muscles in the middle of the back, if it supplies some of the organs, like, your hearts, your lungs, then that means that they're not going to get 100% information, and then they're not going to work at 100%. So it's really important that we focus on getting that back in alignment so your body and your brain can talk to one another.
Okay. I can understand that from a perspective of an adult. I do go to the chiropractor quite often, or sometimes even frequently. But the thing is, what brought me into this area is that I do deal with intended parents who have, spent a lot of money, a lot of effort, a lot of emotions into this, and they have now a surrogate mother carrying a child for them. So maybe we can start with the idea of a pregnant mom. So This baby is obviously just not delivered yet, and I'm holding it in my womb because that's just what I am. So
You're pregnant now?
I'm pregnant with this head just popping out right now. So I can understand, you're talking about the kinks and hoses and everything. So that's obviously curled up inside.
Yeah.
How are you actually going to stretch out or do whatever you have to do in terms of chiropractic when it comes to this part to help the baby, and does it help actually the pregnant woman itself?
Absolutely. No matter what professional you talk to, if it's your obstetrician, if you're also seeing an acupuncturist, physio, massage, prenatal yoga, the biggest thing that we all want to focus on is that making sure that the pregnant mom is not under stress, because we know that when pregnant women are under stress, you have higher incidences of having complications from birth, having a difficult labor process, having the use of interventions, which again is not safe for the baby. So we're trying to minimize the risk of that by taking the stress away, because research has shown that chiropractic directly calms down the nervous system.
So do you have to go a little bit lighter? Do you have to go use different kind of techniques or ways to crack my bones?
Absolutely. So many people, we come to us like, oh, I don't know, I'm pregnant, I heard it's not safe. All the doctors here are trained in many different techniques. I incorporate a lighter technique, like a drop piece. So we have pregnancy pillows. You may be wondering, well, I'm not going to be laying on my belly if I'm 8 months pregnant, which is true, because laying on the belly.
Oh, you can do chiropractic even up to 8 months pregnancy.
Oh, actually, all the way through.
Okay.
I have many patients who have treated from the time that and usually we're kind of funny, it's we're the first ones they tell that they're pregnant. They haven't told their parents yet, or their
coworkers. Really? Oh.
Yeah, because people are like, oh, is it okay if I get adjusted while pregnant? I'm like, absolutely. It's one of the most important times.
Because actually, I've heard of some Western doctors that say, you should stay away from the doctor of chiropractics. Have you heard that before?
I've heard that often. Yeah, for sure.
So what would you say to people like that? Obviously you're a chiropractor, you wouldn't want them to come, but what do you say when a doctor like that just says, don't go to a chiropractor?
I think there's a lot of misunderstanding about what we do. So number one, for comfort of the mom, let's grab these. So we've got all these pregnancy pillows here. So you can see there's an indent, and we've got 2 of them. So we stack them depending on what stage of pregnancy. You're gonna be
I'm full term.
You're full term, so we would. So for Nathan at this point, we'll double stack the pillows.
Natalie.
Natalie, double stack the pillows, and then the belly would be positioned in the crevice here, so kind of like
Get off
that.
my table. So I will demonstrate as I what? Do I lay on top of this thing?
Yeah. So the belly would be in the middle.
I'm too big at this point. We're just land on this.
No, on your stomach.
Oh, on my stomach.
Yeah. So then, see, this is a cradle for the baby.
How is this not going to crush the neck? Or at this point, I feel like I'm going to snap the neck of my baby right now.
No, that does not happen.
Okay, this is quite hilarious. Okay, So I'm in the crevice and...
Yeah, and so you kind of relax your forehead
I
down
don't
and
think I
your
can
arms.
relax this.
Anyways.
Okay.
So then we'd have a drop piece where we actually would just lift the drop piece up. So you can see that there's no turning or anything of the pelvis because the ligaments are very loose. And you just basically would feel a slight pressure, you know, right on the low back or the pelvis, depending on what we're finding.
Okay.
And they found actually...
Come back to the screen. I think I just crushed that baby. Okay. That is pretty good. I think that we've covered the whole pregnancy part, and now I've just delivered through lifting my shirt, as you can see. I don't think
Nathan still really understands what it would like to be pregnant, so...
You know what? That is going to be a social experiment at some point in time, I'm sure. So, okay, so you've talked about how it's safe and gentle for the pregnant person, and for the actual baby, I'm feeling very weird looking at this baby. It looks like it came out of a horror movie.
I bought it at the store. I had to use it for one of my certification classes. So.
Certification classes, so that we covered that. You know what? Why don't we just quickly touch base on, I know what it's like as an intended parent to actually spend all this money and then you just want to basically bubble wrap this baby, right? So the fact is, if I'm going to just give you this baby, well, I'd probably just hand it over like this, I would be very scared of you cracking its bones like you would do it. I'm so sorry for using cracking your bones. I mean, I hear cracks all the time and they're...
And that's very different. And like the cracking sound is just air being released from the joint. It's not like the bones like grinding upon one another. But I mean, so babies are pretty much all cartilage. Like, you know, they don't really, the bones haven't, like growth plates, you know, haven't fused it. They don't have solid bone. So it's very different. The adjustments that we give a child, we use the pressure like when you're like checking a ripe tomato. So unless like you're like the Hulk or something, you're not like...
I've never cooked, so...
Okay, well...
Checking a ripe tomato, so to check how much riper it can get, or...
We'll just say the firmness of it, which is very light, like... So this is what I would do to check a tomato that feels like that seems very light.
Which would be light for a baby.
Yeah.
Or
because they're all cartilage, it's very, very gentle. Like I'm actually, if I was holding a baby right now, like this pressure.
Oh, so you don't... Oh, I have no idea what happened there.
We can put them on the table, or sometimes it's more comfortable if mom or dad has them on their belly while we're checking the spine, or we can check them upright. So whatever's most comfortable, honestly, for the kid, we can check. And then basically I would just be checking the spine, checking the neck, the pelvis, and just checking the motion of the joints.
Okay.
Very, very gentle.
So very gentle, and then...
I've had babies sleep, honestly, through their adjustments.
Oh, so it's that gentle.
Yeah, they just, like, completely sleep.
Because my impression of this was just like... Well, I was thinking it would be on this. And then just like...
Yeah, I don't put the baby down that hard. It's very gentle. And I think that's what happened around the whole time of like the Twilight, karate movies. Like people just saw that. Like people's like, now you made it like The Exorcist. So people got really, really freaked out and scared because like, well, is that what you're doing to like my child's neck or mine? Or your pregnant women too, because their ligaments are looser, obviously, with the relaxin hormone in the bodies. Like, is that what you're doing to my neck? And no, chiropractic adjustments are not like that for babies, for kids, for adults, for seniors. Absolutely not.
Okay. Well, basically, I guess... In short, I hopefully in those few minutes, if people are going to be convinced to hand this baby over to you and just basically do whatever you got to do in this magic, what do they look for in a chiropractor? Are all chiropractors specialized in pediatric and prenatal like adjustments and?
So what I took upon myself to do, because I like to be overly prepared for everything, there's an International Chiropractic Pediatric Association. They offer a certification program. So I did that entire program right outside of school. I also got Webster Technique certified, which is a special technique that actually helps increase the space of the pelvis. And actually, it's been found that it actually helps position with the baby, because when you get adjusted, the pelvis gets more room, and then the baby can kind of go in the normal position, which is ideally head down. Mm-hmm. So you can go to the ICPA website, icpa4kids.org, and you can actually type in, like, say you're in Newfoundland or you're living over, like, you know, Vancouver Island. Just type in your city, and you can hopefully find a chiropractor who is associated with the ICPA, Webster Technique certified. And it's an international association, so people also in the UK have done the course, over in France. So.
And is that more for, like, the baby side, pediatric side, or is it more for like the prenatal?
It's for both.
Okay.
We get trained in both pediatric and prenatal. So we do take some courses in chiropractic, but for myself, I took it upon myself. Like, you know what? I want to make sure that I know everything I can, and I'm still learning. You know, always like there's different courses that you can
You just learn not to like slap it down the way I just did.
Yeah.
Okay, well, awesome.
Nathan's not on his way to be a chiropractor yet for pediatrics.
Next life. Okay, next life. Well, thank you so much, Dr. Tamara Chan from Full Potential, because I have lots of potential now as a person just advocating for these different types of alternative treatments. Thank you so much for joining us, Dr. Tamara Chan.
Thank you. I appreciate it. Okay, thanks everybody.